Problems are showing up more frequently in Virginia hospitals, even when patients are admitted for unrelated issues.
We're talking about 26% increase over 5 years in depression diagnoses. We're talking about 45% increase in PTSD diagnoses. So those are substantial numbers. They're numbers that make you pause and do further evaluation.
Julian Walker with the Virginia Hospital and Healthcare Association says hospitals are seeing the biggest surge among older adults, a group already managing complex health issues.
Our data shows that there was a 39% increase in depression diagnoses over that 5-year period, 2020 to 2024, for patients who are 60 plus who were admitted for inpatient care in a hospital.
Community hospitals are handling most of these admissions as state psychiatric facilities have not expanded at the same pace.
There are a significant number of hospitals with behavioral health inpatient units and not as many state hospitals, meaning government psychiatric hospitals. Our members are handling the overwhelming majority of these admissions every year. You look year over year, and our hospitals are handling in excess of 90% of the behavioral health inpatient admissions.
And once patients are admitted, their stays are lasting longer, requiring more staff and resources.
Several years ago, when you looked at the average length of stay for a behavioral health admission, on average, it was somewhere in the magnitude of about 6.5 days. It is now 8.7 days. So what that indicates is it requires, in many cases, more staff involvement, more resource investment, a longer period of time to address that patient's needs.
Walker points to the pandemic as a turning point when all types of hospital visits fell except for mental health visits, which held steady.
There is data that suggests that Americans feel like their overall mental well-being has declined, even while a lot of other hospital utilization declined during the pandemic. People were still seeking mental health, behavioral health care.
Walker says these numbers are a wake-up call, and meeting the growing demand for behavioral health care will require everyone from providers to policymakers to act.
There is growing demand for care, and there is, accordingly, an enhanced need for clinical folks, hospitals, and policymakers to continue to work together to really look at these thorny issues and try to come up with solutions.